Hello everyone, welcome to Spine Focus. In our last video, we discussed how an osteoporotic spine fracture can affect elderly people and that most of these fractures can be managed without surgery. However, keeping elderly patients on prolonged bed rest can cause complications like blood clots in the legs, chest infections, weakness of the muscles, and they may even lose confidence to walk again. So our goal is to get them up and walking as soon as possible. But sometimes the pain due to the fracture is so severe that they are not able to mobilize, sit or walk even with pain medications or a brace. In such patients, we have a very safe and effective surgical procedure which is called as vertebroplasty. Vertebroplasty is a procedure where we pass a specialized needle into the fractured site or the fractured vertebral bone. We inject a material called bone cement. The bone cement is in the form of a liquid while we are injecting, but once it is within the bone, it hardens and solidifies. When it solidifies, it stabilizes the fractured segment and immediately reduces the amount of movement that is happening within the fracture site. When the cement hardens, it provides mechanical stability to the site of the fracture. Most of the patients would experience immediate pain relief and they should be able to stand and walk the same day evening, and they usually get discharged from the hospital the following day. This procedure is usually done under C-arm guidance or fluoroscopic guidance, which means that continuous X-rays are being done to make sure that the needle is placed at the perfect spot within the fractured bone, and also it helps to visualize how the cement is filling within the fractured bone. This procedure is usually done through a very small incision, maybe about 2 to 3 millimeters, just enough for a needle to pass. And usually it is just a single stitch that is required to close the wound. This procedure is commonly performed under general anesthesia. However, in elderly patients, sometimes they may have associated medical conditions and they may not be fit for a general anesthesia. In such cases, this procedure or vertebroplasty can even be performed under local anesthesia along with some sedation. Yes, vertebroplasty is a very safe procedure and it is very commonly performed in spine surgery. Sometimes a small amount of cement may leak out from the vertebral body and it could be seen on the x-rays, but usually the patients are completely asymptomatic. Very rarely, the cement could leak and could press onto the nerves within the spinal canal, or sometimes it could even pass through the blood vessels and reach the lung. Fortunately, these complications are extremely rare as this procedure is usually done under continuous X-ray guidance, which will make sure that there is no leak. Once the patient is pain-free and able to walk, the next focus is on preventing further fractures from happening. For that, we evaluate the bone strength of these patients with the DEXA scan, and once osteoporosis is confirmed, we treat them with medications for osteoporosis, improve their diet, and focus on regular exercises to strengthen the back and the core muscles. All these aspects have been discussed in detail in the previous two videos. Please check for the link for these videos in the description box below. Remember, vertebroplasty is a very safe and simple, minimally invasive treatment option for vertebral compression fractures in elderly. It helps them to stand and walk the same day after the procedure. Along with osteoporosis management, it allows elderly patients to regain their active life as soon as possible.